We're live.
Hey guys, it's Dr. Emer. We just did our right part of the procedure called BBL Hero. Now we're combining with Fraxel. Why are we doing Fraxel? So I'm going to start at your cheek on the left side, okay? Why are we starting doing Fraxel on this patient? Because this patient has very light skin tone, and the issue with her is textural irregularity. Very superficial, and sometimes going back to old school, doing a very specific setting and passes can give us an even better result in certain cases. So here's an example where I didn't choose to do halo and I'm using Fraxel. That doesn't mean that anything's worse or different. This is the best choice for her. It all has to be customized. What do we do in our consultations, Jordan? What do we do for every client?
Every consult is specific to the patient's needs and their goals.
Exactly.
And we set realistic expectations with them.
Exactly. So for her, I listened and I understand what she's looking for. And so right now I'm using our thulium wavelength. That's going to focus a lot more superficial, get a lot more of the pigmentation, some of the redness, and some of the fine wrinkles, and be anti-aging for her. Also, it's going to be really protective against skin cancer. So I know she's flinching a little bit. It's not the easiest to do. She thinks it's worth it. She's smiling and not like yelling at me. And I've done this for many years. I actually did my first Fraxel when I was 27, and I'm 41, and I've been doing Fraxel ever since I was 27. So now I do halos sometimes as well, and Moxie. There's a lot of varieties of lasers, but in this instance, to get her what we need with the deeper indentation that she has on the right cheek, which I'll show you guys in a second.
Which is gone.
Which is basically gone with Bellafill and laser. One more time. Now we're focusing on the color. And this is gonna be really good. Now she chose not to do nerve block. She's a strong woman. She has kids, she doesn't need to. So that's why she's flinching a little bit, but it's worth it in the end. We're basically done with the passes. So I'm gonna show you guys.
Hey doc, does this help with rosacea?
You know, this isn't the actual treatment for rosacea, but non-ablative lasers do help when you combine it with the vascular laser, which is what we did for her today with the BBL. So you could do that combination. Now I'm gonna show you guys something. Look on this right cheek. We already did the deeper wavelength. So take a look. Look at all that swelling. This is called perifollicular edema. You could see all the little dots, even down here, causing significant swelling. So that's good. That means it went really deep. Now we're gonna go a little bit higher on the surface.
Someone wants to know what this feels like. Can our patient tell us?
It feels prickly and hot, but it's good. I mean,
So
you can handle it.
She can handle it. Strong woman.
I don't even have a nerve block.
She doesn't have a nerve block. So I did the deep laser already on this cheek because she has some scarring that's there. And I'm going over it with a superficial laser. Caution to the wind, you guys, caution. This is not a combination that you would do if you're inexperienced. It can actually cause burning and blistering if not done correct. There's a very specific way that I'm doing this. I've done this for many years. This is not the suggested way in which somebody would tell you from a company standpoint. But from experience, this is the way that we're gonna get her results more quickly with minimal risk in my hands. So
Yeah, I went to the wrong person the first time.
and everything's okay now. So you guys can see there was a scar right here. I'm gonna pinch, look, the scar is basically gone, it's volumized. And then now we're just resurfacing over. All right, one more.
Does this one help with fine lines and wrinkles? And is it preventative? Guys, it is.
Very. This was the gold standard treatment for fine lines, wrinkles, sun damage since the 2006 until our newer devices came out. All right, last
Might be a provider question. How does this compare with plasma resurfacing, for example, Opus or Neogen?
Totally different, you guys. This is non-ablative laser. That's radio frequency plasma, fully ablative resurfacing, non-comparable.
Just joined.
All right,
a microneedling facial, and what are the benefits of this facial being done?
This is not a facial. This is a laser called Fraxel. And you could do, you guys gotta pull this down, you could do a microneedling facial in between these to give improvement in her skin and keep it glow, but it's not gonna be, it's not gonna be what we're looking to achieve overall for her with the color and texture of her skin.
So we're asking for scars, do I do this or for fractional? That's going to depend on the exact scars on your face, your treatment plan, and your goals. You guys are going to want to send us a DM with your full name, email, phone number, so our coordinators and Dr. Emer can look at your scars and get you the best treatment plan.
Exactly.
So just get rid of facial fuzz.
No, you got to do hair removal with our Airlays, or you got to come in and get dermaplaning. Do you guys know what dermaplaning is? Anyone? Jordan, do you know?
No.
Dermaplaning is when you take a little blade and you shave off all the baby hairs. Jonathan, Misha, they could do that in their facials, and it's really a good thing for girls that have like those little baby fuzz.
What is the downtime on this one?
About 3 to 5 days. What did you think your downtime was last time?
Yeah, I'd say by 5 days you feel a lot more comfortable.
Yeah, it's really not that bad. It's more like red. There is some speckling. She's going to be doing skincare, and even more special, we're going to add our Aerify mask to enhance the outcome.
So in the comments, I've done fractional and professional, still have some scars. What do you think is best?
Bless you.
You guys need to send us a DM and your full name, email, and phone number. We'll reach out to you and we'll help you out.
Do you want any Kleenex? Do you need Kleenex or you're good?
There's nothing.
Okay. So FYI, you are never going to get rid of scars completely, okay? So you're always going to have to maintain. Oh, bless you. It's probably the laser. Sometimes it causes a reaction. Yeah, it does actually.
How is this different than an erbium?
Well, erbiums are ablative. This is non-ablative. So we're not burning the surface. It's non-ablative. So look, there's no scabbing, there's no burning. This is just heat. Thank you.
That's a reflex.
I know. It happens often around the nose or the upper forehead.
It used to happen when I'd get my eyebrows done.
Oh, really? Oh my god.
But more, like.
Oh my god.
Sneezing.
Someone says thank you for giving a lecture while you're working.
Anytime. So now I'm doing nose, pores, and pigmentation. You guys know that the nose is one of the most common areas to develop skin cancer, and so are eyelids. So that's why you gotta laser those areas at least multiple times a year to just prevent skin cancer from forming there. What are you saying?
Dr. Emer, a few questions coming in. Can this be done on a Fitzpatrick 4 and above?
Yes, it can. You can do this Fraxel on any skin type.
And can you get TCA cross and do a halo 1 week apart? You can do them the same sit.
No,
Yeah.
you cannot do a TCA cross and halo again a week later. You could do TCA cross and halo together and wait about 1 to 2 months, or you could do the TCA and then the halo right when the TCA peels. All right, lastly, I'm just gonna do a little anti-aging, get under the eye. Good. Still make her swell a little bit more, but it's gonna.
How much is the surface? How many times does one need to do this? Normal skin?
Gotta do a consult.
You guys gotta do a consult.
This is a maintenance laser.
Send us a DM, full name, email, phone number, we'll reach out to you.
This is a maintenance laser, you guys. Every quarter you want to do this. And if you keep going in the sun, you might need it more. You know? All right, this is it.
This prevents skin cancer.
And you guys can take a look. My innovative optic goggles. Is she gonna put the Aerify on at home, right? Mm-hmm. Are we doing it? Yeah, that's what I figured. She's not gonna want to walk around orange all day. So take a look. I'm gonna show you guys. We're gonna give her the cold air. Here's the cold air in your hand, really quick. Hold that. Perfect. Hold on. Below that, she's gonna give you the tube. Blow that on your face and take your goggles off. So you guys take a look. And give me a little grace here. Turn that up. Blow that on your face. You're gonna feel so much better. So take a look. It's just red. This is the thing about non-ablative lasers. They look swollen and they look like a sunburn. They're not scabbed. They're not bleeding. You guys know with halo, as there's erbium, there's little holes on the skin. You guys know with CO2, it's burned, it's really red, it's bleeding. You don't see that with Fraxel. All the little channels, I can feel them and you can see them if you come up close. Look at the little channels. All those are deep dermal heating. We're gonna lift the pigmentation up. We call it MENS, microscopic epidermal necrotic debris. Those are gonna fly off in the next couple of days and our skin's gonna look great. And the goal is this area right now, looking completely flat, because that's where she had those deep scars and now they're gone. So follow along as she heals. Thank you guys. Have a good day.